name's Lena. I'm a student physical therapist. Is it okay for you to be in this video and for it to be viewed by my teacher and fellow classmates?
Yes.
All right, so we're going to be doing the Lachman's test for ACL and the McMurray's for meniscus tears. So to begin the Lachman's test, we're going to go into no more than 30 degrees of knee flexion, and then we're going to stabilize the femur, and then I'm going to apply a posterior to anterior force on the tibia. If the tibia translates anteriorly excessively, or if there's a soft infill, that would be positive for the Lachman's test for ACL tear or rupture. And then for the McMurray's test, I'm going to passively bring you here. I'm first going to feel for both meniscus on either side, and then I'm going to bring my patient into knee extension and feeling for popping or clicking feeling. I can differentiate medial and lateral. Medially, I can bring the tibia into external rotation, do that same motion, feeling for popping or clicking on the medial meniscus. And then for the lateral, I can bring that tibia into internal rotation, doing that same motion and feeling for popping, clicking, or pain in either of those sides. Okay, so that would be for the meniscus tear. And then for our range of motion exercises, we're going to move into those while you're still laying down. So to help with knee extension, we're going to prop this towel underneath the ankle, and then we're going to take this a step further. I'm going to have you do a quad set, so bring that knee actively bring that knee into the table, and we're going to hold that for about 3 to 5 seconds, and then you're going to relax. And we're going to do that 2 times or 2 sets of 15 reps to help that knee extension. To help with knee flexion, we're going to take this towel and you're going to assist yourself in knee flexion by putting this around the foot. You're going to hold the towel. Yep. Is that better?
Yep.
Okay, and then you're going to assist yourself, but still try to do a lot of the work and hold it here for about 3 to 5 seconds and then release. And then again, we're going to do that 2 times, and we're going to do 2 sets of 15 reps and hold that there and then go back down. All right, so that is going to help with knee flexion. And now we're going to move on to our manual interventions. We'll say that my patient is only able to make it here with knee flexion. So I'm going to apply an anterior to posterior force of the tibia, and then you're going to slide your heel towards your bottom, and we get there, and I'm going to release. And we're going to do that again. I'm going to apply the force, go ahead and bring your heel to your bottom, and I'm going to release. We're going to do that 3 to 5 times or until I feel that my patient has gotten to the range that we want to achieve. So now to help with the knee extension, I'm going to have you flip onto your stomach. And that was a movement with mobilization. Now this is going to be an MET, a muscle energy technique. So let's say my patient's only able to make it to here with knee extension. I'm going to have you press into this hand that's on top just slightly. And then I'm going to have you release, and we're going to bring you into more extension of that knee. And then I'm going to have you press into this hand again and release. And again and release. And we're doing that for 3 to 5 repetitions or until I have achieved the knee extension that I would like for my patient. How are you feeling?
Good.
Okay. So we've covered the 2 special tests, the range of motion exercises, and the manual interventions that we would like to perform.